Hi everyone, welcome to Self-Balance Live. I'm Szenan-Balance from Self-Balance, the acupuncturist. All right, I have a few cameras in front of me. I'm going to talk about today's topic is about arthritis treatment. So what sort of treatment that do you need to get if you suffer from arthritis? What would the Western doctor do for you? A suggestion for you, suggest you to do, and what are the acupuncture and Chinese medicines can do for you, right? So what else can you do? Now, today we're going to talk about the just the treatment, okay? And tomorrow we're going to talk about what else can you do. Like when we talk treatment, it should including lifestyle change, emotional, managing your stress and your diet, all this thing, and not just acupuncture or painkiller medications, but the topic will be quite a lot of contents, which means we're going to talk about just the doctor or practitioner treatment that you have to see someone to get the treatment, and medications as well. Then we're gonna put what else can you do, like the lifestyle changing, emotional, the other things that you can do at home and tomorrow, which means tomorrow we're gonna talk about acupressure point. Then tomorrow we're gonna talk about diet, and tomorrow we're gonna talk about something that you can do at home. But today's treatment is about Western medicines and Chinese medicines. All right. Now, if you are on this live video, please give me a thumbs up and let me know who you are, where you're from. Are you an acupuncturist? Please reply 1. If you're not an acupuncturist, please reply 2. Now, and further on, if you're on Facebook, on Instagram, please share this video. Right? Please share or tag your friend into this video. All right, let's start. Now, for the arthritis treatment, the main goal of the treatment is to reduce the amount of pain that you experience, your patient experience, and prevent additional damage to the joints, right? We know that arthritis is a joint issue. We've been talking about in the last few days. Now, you will learn what work best for you, right? In terms of controlling the pain, okay? Some people find that heat pack, heat pack is very, very useful, which we're going to talk about tomorrow, because something that you can do at home. So some people find heat pack help, and when the joint is inflamed, it actually create heat, swelling, and you can see that when you touch it, it's hot heat sensation. Then ice pack may be right for you, but ice pack only do it temporarily. Most people love heat pack, right? Love heat pack when it's acute arthritis, when it's painful and acutely happen, and then heat pack ice pack may be good for you for a while, but for the long run, heat pack is what we would suggest our patient to use. Okay. Other people may use a mobility assistant device like some walking stick. If the pain is in here, on here, your knee or your hips, then a walking stick, a walking things that support you, and so you can hold on, so you get less pressure. So lean on something, so less pressure on your joint of your knee and hip. So they may help you, right? This is something that's important. to know of. Okay, let's have a look. Okay, I'm just checking down the okay, preview the title. This should be okay. Hello, how are you? Just doing my acupuncture page. It seems that it doesn't work properly. Does it work or not? Start, please. Okay, I have to reset my Facebook page on the acupuncture page. So give a minute. We're gonna go through and tell you what medication actually we suggest for arthritis. Okay, it's not working. All right. I think we'll leave the acupuncture page or just forward my clinic page into acupuncture. I'm good, thank you, All right. Okay. Now, because my other computer is very, very slow. Now, medication. So a number of different type of medications that treat arthritis. One of them, like painkiller, right? There's few type of painkiller. One is called Vicodin. So Vicodin and Tylenol, they are both quite common used for arthritis, but they are effective for pain management, but don't help decrease the inflammation. So they don't have the inflammation at all. Okay. So when you take those Vicodin, you have to be aware that there are side effects, and I'll tell you what happened with those two drugs. And the first side effect is your stomach and spleen problem. When they are another painkiller that often used for arthritis is ibuprofen. Ibuprofen that you can get it for over counter, and that is another type of we call non-steroid anti-inflammatory drugs. That's ibuprofen, and you might recognize. In New Zealand, we talk about ibuprofen all the time, and in other countries, it may call Advil. Okay. But you need to be aware of these two drugs, ibuprofen, because they help control they help control the pain as well as inflammation, but you have to aware of they actually making you sick as well. So what is the common side effect for ibuprofen, Vicodin, and the other called Tylenol? Okay, those painkiller, they have a common side effects of your hurting your stomach. You may get bloating, diarrhea, constipation, or vomiting, nausea. Okay, those are very common side effect of those three painkiller commonly used in arthritis. Now, apart from that, they may give you like ibuprofen may give you dizziness, headache, nervousness, and decrease your appetite. You see, and even ringing sound in your ear. When you talk about ringing sound in your ear, which means it's harming your it actually gives you side effect in your kidney. Okay, this is according to Chinese medicine. Okay, then when Vicodin, it gives you anxiety. It gives you dizziness. Same as the other ibuprofen and light headache. Right now, we talk about the common thing is they give you stomach issues, like you can get upset stomach and vomiting and nausea, right? And constipation. Now, it also gives you anxiety. So anxiety is the when the is the energy, emotional energy that is from stomach and spleen, you know. So this drug is all about mainly the side effect is for your stomach and spleen, right? Now, what about the other called trigeminal is pretty much the same, you know, nausea, stomach pain, loss of appetite, and it also have skin issue, itchy and rash, you know, and dark urine, clear color of your stool, you know, it make your bowel motion change color. Hi, Sirik, how are you? Nice to meet you in Instagram. Now let's try my live video on my acupuncture page and see whether it works for. Give me a minute, please. So let's talk about, while I talk, there's another medication that your doctor may suggest you when they are not working well, or the painkiller drugs not working well. They will suggest you using cortisone, you know. So the cortisone or prednisone, you know, those two drugs, okay. And let me tell you, those two drugs is something it not just using for it's not just using for arthritis. Anything that it doesn't work, okay, anything it used for everything, anything, you know, anything that it is very good for reduce inflammation, and it's actually good for pain as well. Very good for pain as well. And just about any kind of disease. And when there is no treatment for it, when all the drugs not working, it'll just give you cortisone. Our body produces cortisone itself. You know, you need to remember our body produces cortisone itself, but sadly, not enough to reduce the pain. You know, so they give you cortisone. But when they give you cortisone, when the doctor gives you cortisone, and a lot of people didn't know that there are side effects, and a lot of people get this side effect, and it's very, very common. Okay, you probably have painkiller before, and you feel stomach pain, and you get lost appetite. But once you get cortisone, prednisone, what you get is you get excitement. You suddenly get a lot of energy, you know, and you eat a lot, okay? But at the meantime, some people may get, you know, still nausea, vomiting. What is it? Stomach problem, you know. All the drugs will ruin your stomach, okay? And when you get so excitement, a lot of excitement, but you feel tired at the meantime, and it will increase your appetite. You eat a lot. Then what happens is, even though you eat a lot, and you get very tired, and you put on weight for that, and that is very common. You put on weight. Okay. Now, if you're an acupuncturist, hi Aladi, nice to meet you. If you're an acupuncturist, now those are the drugs that we need to know that the Western doctor may suggest patient to use painkiller and hi Amida, nice to meet you. You use the painkiller as well as the in the end, if the painkiller doesn't work, doesn't manage very well, and they will suggest cortisone, okay, or prednisone. Apart from that, they will suggest some cream as well, and cream is pretty okay, but some people still like, you know, allergic to cream, but not very common. Okay, now what we're gonna do right now further on, now this is something that Western doctor will suggest, as most people will do for that. So as an acupuncturist, that you need to understand what sort of drugs they are taking and what sort of side effect they may get. Why is that? Because you're gonna ask your patient, right? Or if you're a patient, you need to think about it before you start taking the drugs. You first have joint pain and you start to get painkiller when it's not working well, and then it gives you cortisone, prednisone. Then you need to think about it. Okay, now I have stomach problem, and now I have diarrhea. I have nausea and vomiting. Then you will think naturally. What people think is, oh, what the hell? My joint pain. I'm so unlucky because I first started to get joint pain, arthritis. Then I put on drugs, try to control the pain, and now I end up with stomach problem, bloating. And naturally, people think about is because it's getting worse. The joint pain is getting worse, and then you start to get stomach problem or urine problem, and anxiety. You thought it is a progressive of the disease of arthritis, but it may not be. It may not be. It can be just the side effects of your drugs. When you go to a doctor, you talk to them about it. I have stomach pain, blah, 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 and your doctor don't naturally click their mind and say, oh no, this is the side effect of the drugs. And they'll say, okay, now it seems like you have a stomach problem. I've seen a lot patients and they're on cortisone and they're on ibuprofen, and they start to develop with stomach problem, and they go back to the doctor and they run a lot of tests because of stomach pain and bloating and diarrhea, and they didn't click their mind that it's actually the side effect of the drugs. And they started running a lot of tests and they feed you more medication, try to fix the bloating, pain, nausea, or vomiting. And they didn't realize it. And some patient is so smart. Why do I say that? Because they go and check the side effect of the drugs, and they literally stop way off the drugs. Yes, they feel pain. They feel a lot of pain in the joint. And what happened is they feel better in the stomach, and they can eat properly, no longer nausea and vomiting, and decrease in anxiety. So this tell is the sign. The patient work it out herself. I've seen quite a few patients. They come in and say, yeah, I stopped all the medication. It's not good for me. I said, how did you find out? Because when I take it, I have stomach problem, bloating and vomiting, and it's not myself, and I get anxiety. I said, did you get anxiety? Because arthritis causes anxiety too, and depression. I said, no, I didn't get that. Not until I start the medication, and I find out the side effects is from the medication, and they stop it. And what happened? They stop the drugs. Now I just have the pain in my body in the joint, and I no longer get stomach pain, bloating, nausea, vomiting, anxiety. You see what happened? And what they say is the doctor trying to put them on other drugs for it. So if you're a practitioner, you didn't realize that. If you're a patient, you just listen to your doctor and you didn't realize that those drugs have side effects. And when the side effect came out and you literally suffer from the side effect, if you didn't realize it, and you will take whatever the doctor suggests you, more drugs, more medication, which won't help you. Okay, so this patient, they stop it and they come for acupuncture and Chinese surf for the joint pain, for the arthritis. So the acupuncturist, you need to, I always ask my patient, okay, now these are the medication you take. Now you have all the symptoms. Then tell me, the stomach pain, bloating, blah, 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 do they get worse, even worse, since you start the medication, the painkiller? Or do you suffer from this symptom before you taking these drugs? If it's not, if those symptoms come after taking a while from the painkiller or cortisone, I will say, well, this is what you say, and I write down and say, well, this symptom come after the drugs when you're taking. It may not appear straight away, but any symptom come after the medication, you need to suspect it may caused by the medication. So we talk to patient and we tell the patient, go back to the doctor and say, tell your doctor about this, because the doctor need to know about this. The doctor need to know about this. And then we say, don't worry, I'll treat you. Once the symptoms wear off, then you need to tell your doctor about it. How can you slowly wear off your medication, reduce your medication? This is the way how we tell the patient and how my patient can gradually reduce drugs they are taking. So this is very, very important though, because a lot of people didn't know that they can do that using acupuncture and Chinese herbs for a while when everything starting to get stable and they wear off the medication slowly. Okay, now I will share some of this case study in the future. Then I will recently I have a patient who is actually trying to reducing her blood pressure medication. So what happened is she take her blood pressure twice daily, and we can tell from what her monitor her blood pressure. And since she taking the drugs and she had the side effect of it, then now started acupuncture, the side effect actually way off. And not just that, her blood pressure is getting stable. Then I'm thinking, okay, in my experience, in the next 2 weeks, then we'll be able to start to reduce the medication. Now she take the medication every day, and then she actually monitor her blood pressure. So it's interesting, and one day that I could show everyone this case and let you know how we actually slowly reduce the medication, how we suggest it step by step, and I tell her no, let me type something in here. No reducing medication at the moment, all right, because the blood pressure is not stable yet. Acupuncture treatment, arthritis. I'm just typing something on my Facebook and go live. It seems I can't go live at all on the other computer. But anyway, now let's talk about the when it comes to, it doesn't matter which is RA or OA, right? Those medications I just mentioned are common use for them, common use, okay? But when it comes to RA, it may use some drugs that is for autoimmune system, okay? Autoimmune system. Then what else? When it's OA, osteoarthritis, especially in the joint, in the hip and knee, in the end, medication doesn't work and painkiller doesn't work, and the pain starts to progress, making worse and worse. And then they will suggest, hey, hip replacement, knee replacement. Hip and knee replacement is the last result. When I say if the acupuncture Chinese medicine doesn't work and the painkiller doesn't work, and you change your diet, it doesn't work. But I'll tell you, if you change your diet, it always works. Okay, it always works when you change the. For those patients, if they come to me and we extend. A patient come to me for, he said, doctor said I need knee replacement, and one other doctor said I need hip replacement, and I gave them acupuncture a few times, and they extended. One of them extended for five years, the other one to about 10 years to end up to get a knee replacement and hip replacement. But I will tell you, those two cases are because they never changed their diet. They just rely on acupuncture treatment and Chinese herbs treatment. So in the end, yes, the pain is not all the time. Pain is comes and goes, comes and goes. And when they have acupuncture, they feel great. And they come back for acupuncture and they feel great for a few months or 6 months or a year, and they come back for another acupuncture, few acupuncture. It lasts for few months, 6 months to a year. And they're great, and they're quite happy about. So one of them do about 5 years in the NSLR. He just want to get replacement. So go then. But if they do the diet, if they change the diet, it'll be a different story. It'll be a different story. Okay, so this is something that patient choose what they want. Okay, not I choose for them. I suggest for them is where they want to, what they want. Okay, now surgery is the last result. Hip replacement is the last result, and BMI. So let's talk about acupuncture today. So this is going to be acupuncture treatment. Okay, if you're a practitioner, and tomorrow we're going to talk about what can you do from at home. Okay, at home, what you can do at home means acupressure point, heat pack, and changing your diet. All this thing we put on tomorrow. We're going to talk about all this thing tomorrow. Today we just to talk about Western medicine, how they do it, and surgery, and what the side effects, and acupuncture. What can we do in acupuncture? All right. So joint pain, if you're an acupuncturist, right? If pain over here, you go to the opposite side or in meridian, get the access point and put needle in. It doesn't matter whether the pain is over here or here. If you get all in meridian, needle all in meridian at the same time, or all young meridian at the same time, it can treat all 6 meridian. Of course, you can treat the opposite side using all 6 meridian. That's up to you. And again, this is a simple one because arthritis go for a lot of joints. So I guess give you one strategy. This is called balance method acupuncture and local balance. Here, this is the elbow pain. So elbow pain over here. Then you go to the opposite side, all 3 in meridian, get the access point and stick needle in. Or young meridian, or 6 meridian. It's up to you, okay? And if the pain is just in here, then you put needle over here. If the pain is that from here to here, at this level, then you put it on this level, on the opposite side, same as wrist, okay? What about hips? Yes, hip we can do the opposite side hips, but when you do the opposite side hips, you may feel okay, a bit awkward. You have to ask patient to remove the pain, the things like that, to privacy in here. Can we do it on the shoulder? Yes, you can do it on the shoulder. All right. Then how about knee? Can we treat knee using the elbow? Yes, you can do. So treating here, it can help with this elbow and knee. Treating here, you can help your shoulder and hips. Treating here, wrist, it can help the ankle and wrist. Simple, right? But if your patient just having the arthritis in one joint, this option, this strategy is good for it. But what about if your patient come in, say, multiple, like we said, arthritis, it can happen in one joint or multiple joints, right? When it happens in multiple joints, which means pain in here, 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 and here, and here. Oh dear, where do I put needle? Simple. You choose one arm, here, here, here. So 3 in meridian, 3 in meridian, 3 in meridian. So you stick on 3 in, 3 in, 3 in. It can treat all the joint, That's one strategy for you, local balance strategy. Or if pain in here, you treat 3 in over here, and that you don't put needle, you treat 3 in on the opposite side over here, right? And then here, you treat here. So basically 3 joint. If you're treating those 3 joints, it can cover here, 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 here. Cover all the joints, right? Cover all the joints. Okay. Let me show you Magical 12. Magical 12 are the best treatment in a distal acupuncture for multiple joint pain. Okay, multiple joint pains. Okay, here it is. You can needle here, Jing Wao point, and 3 in on that side, and 3 yang, Su Jing point, Su point or Jing point on 3 yang over here, and 3 in here, Su point, Jing, oh sorry, this will be Jing, Jing point, Jing Wao point on that side. Okay, let's say it's 3 in, Jing Wao and 3 in, Yang, Xing Su point on this point, on Yang, Xing or Su, or here, in, right, 3 in, Su and Jing, Jing river, okay, Jing, Su and Jing, and over here, Yang, 3 yang, right, you put her point, okay. So we use 5 Su point, Jing, Xing, Su, Jing, He, right? Jing, Xing, Su, Jing, He. So the first group, you put Jing, and the last group, you put He, and they have 2 groups in the middle, right? You can do Xing, Su, or Su, Jing. That become another 2 group. So 1, 2, 3, 4. 4 group of needle, 4 group of point, right? Jing, first group. Xing Su, second group. Su Jing, third group. He, the last group. Which means needle here, over here, then over here, then over here. It works from the toes up to here, up to here. You see what so when you treating from here to here, it works for the entire body. So this is Magical 12. I hope you get it. So you can start up with 3 Jing Wao, Yang in here, or Yin in here. Then you rotate from here, or you rotate the other side. That's fine. You can say, well, I got 3 Jing Wao in here. Then Xing, can I put it in here? Yes, you can do it. Or you can put it in here. I don't know the name of the English name, I'm sorry. I learned it in Chinese, but Jing Xing Su Jing He, you should be a bit familiar with it. You know, Jing Xing Su Jing He, Jing Wao point, Su blah blah blah, you know, He Si point. They're talking about this. So this is He Si Jing Wao, or talking about Jing Xing Su Jing He. And all meridian have Jing Xing Su Jing He. If you're an acupuncturist, this is something that a lot of people miss out, and they don't learn it properly, they don't use it. But now I tell you, go and pick it up again, what is Jing Xing Su Jing He, and we watch this video if you want to learn properly. I tell you everything already. If you put Jing point over here, the 3 Jing point, Xing or Su point on that side. If you put Xing point on here, then you can put Su point on here, and put He point in here. Okay. Or opposite, you can do Jing, 3 Jing, Xing on the leg, Su in here, He point in here. You see what I mean? So you can rotate over there, or you can rotate over here. But first you start on one hand or one leg. You can put Jing in here, 行舒和 or 经行舒和 something like that. So it's very simple when it comes to medical talk. Okay, but you know, let's say if I just treating all the joint pain, I put Jing point in here. Then second needle I put it on the wrist. Third needle I can put it on the ankle, and the fourth needle I put it on where? On your knee, and that's fine. That's fine too. Okay, there's 4 group. All right. I hope it makes sense for you, and it's so simple. That's it for today, and hope you enjoy this live video. Tomorrow we're gonna talk about treatment as well, but the treatment is what can you do at home. We're gonna introduce acupressure point, and we're gonna introduce what can you do from home, like heat pack, you know, all those things, you know. And we're gonna talk about diet as well. So if you change the diet and control your emotional, manage it well, then the treatment that you do from your acupuncture or Chinese medicines, then it will help a lot. It will speed up and it will maintain there. Okay. Yes, we didn't talk about Chinese medicine because most people don't know how to do Chinese medicine. And when it comes to arthritis, we mainly use acupuncture. But when I treat the organ, I always suggest patients to go for Chinese medicine because Chinese medicine is the best for the organs imbalance. Okay, stay awesome, and I love you all. See you. Bye bye.